I am here because I have got a problem with my teeth. I would like to fix it up. First of all, fix it up the way I can eat comfortably and I can smile.
Patient was initially referred by a sister who was also an existing patient. And the question was, can you fix my sister's teeth? She's been to so many dentists and had so many treatments done, and it's all failing, and she's basically given up hope. And when I examined this lovely lady, she said, Dr. Albanian, I want to be able to eat and I want to be able to smile. When you look at this patient's smile, it's quite obvious that we have a lot of problems. And not just a lot of problems, but it requires a considerable cost and time and energy to restore. And it's all very well to say what is an ideal treatment, but ideal treatment is not about what the dentist thinks an ideal treatment is, what the patient feels, what's right for them. And my job as a specialist is to tailor the treatment needs to each and individual's patient's situation, not in their dental situation, but also at the stage in their life. And where are they going? In other words, if a patient says to me, Dr. Albanian, do whatever is necessary, I will proceed and provide an ideal treatment. Not because this is a less ideal treatment, but at this stage, we need to be able to restore this patient's confidence, comfort, and function, and natural aesthetics. Now, the patients of this era coming in our surgeries, and I'm very grateful to the general practitioners, general dentists who refer me these patients as well, the fact that they really want solutions. And over the years of time, dentists try to provide those solutions, but unfortunately, they are very short-term solutions. So we need to provide a long-term solution for this patient. And because of the past experience the patients have, and sometimes when you explain that you can fix their teeth, you can restore their teeth to the old glory, they somehow present with a mistrust because, look, the other guy did the same, I went to the other guy did the same, looks where I am, so how different you're going to be? Well, I'm a specialist. Okay, I'm highly trained. I have over 10 years of postgraduate education. My knowledge has been tested by universities, by world-renowned professors who test your knowledge, they grill you to see how good you are, to bring you to their level. And we understand what is important from the biologic point of view, from a mechanical point of view, and from an aesthetic point of view, how to integrate to create biopsychosocial integration that helps the patient's well-being. In other words, how do we improve this patient's quality of life and their well-being? And dentistry is an important part. It's a holistic approach to the patient's needs. So therefore, our patient who presented today, she has a major problem. As you can see, there's a considerable teeth wear, there's a loss of teeth, there's a high smile line, she got beautiful lip line, a nice frame to the picture, but the teeth are everywhere. There's a partial plash she's wearing, and does not fit, and there's a movement of the teeth across the midline. The front central incisor is right in the middle of the head. That's not a position, natural position for the tooth to be. We need to have the teeth in the right position that is in harmony with the face. And so when the patient smiles, you can see she's a very chirpy, very happy patient, lots of personality, very beautiful lady. Unfortunately, her teeth are suppressing her personality. And the sharpness of the teeth, they're irritating a ton, and the ulceration of the lips and the tongue, and she feels uncomfortable. She feels discomfort. So there's an aesthetic and functional disturbance to this patient that needs an urgent attention. I would call this emergency dentistry to be able to restore this patient. So you can see on different images of this patient how there's an uneven wear with uneven materials, and it interests me to see how much has this patient been able to cope with such a large tooth wear, tooth mass loss of back teeth, and there's no support to providing the loss of the back teeth, unfortunately, has reduced the lower facial height. So in other words, she's mainly touching with the front teeth, as there's no really back teeth that support the bite and the facial height. So her chin is coming more close to the nose. She got a very strong chin, and the lower chin is coming forward for this patient. And in many ways, when she's smiling, she has to overclose, and as she overcloses, it creates excessive folds on the face, giving an accelerated aging appearance. It does make you age quickly, and unfortunately, teeth are an important part of this. We restore the teeth to the original glory. We also restore the patient's bite to the original glory. We restore the patient's facial height to original glory, and their profile. We give them good 10 years of lease, and usually that makes them 10 years younger or youthful looking. So what we did for this particular patient, issues to her dismay, we did initial diagnostics, which allowed me to assess which way we need to go. And we did the diagnosis for her on a model, and we used the model to transfer that to the actual face on her teeth. And on the model, we worked out where I want things to be. We restored this patient directly in the mouth. In other words, I sculpted the whole teeth in the mouth using composites, because even if the finances were an issue, we have to do a long-term provisional restorations to be able to restore the patient's comfort, their bite, their function, their aesthetics. Let the patients try these restorations, because it's taken a lifetime to wear those teeth down, and suddenly we're going to restore them to where we think they were, let's say 30 years ago. That's a very hard thing for people to get adapt to. Some people can, some people can't. We don't know which ones are more adaptive to the change to the ones who are not adapted to the change. So we need to test the system. This is why when we do diagnosis, we have a look at how the patient adapts to the change. So in this particular patient, she adapted to the change very quickly. Her neuromuscular reflexes, the muscles, and all the nerves all thought that this is really good for my face. And after about, it took a long day. It took about good 6 hours for this patient. But if you look at the results, I think she's very happy, because we restored this woman's beauty. We restored to her facial aesthetics that she was accustomed to. I remember her bringing her wedding photo, showing me, and you knew exactly where to go. Naturally, we improved even some of the old photos as well, because I have the opportunity to do so. And why not? Why not improve on things when we have an opportunity? You know, I like to see my patients happy in my practice. I want my patients to be my ambassadors to my practice, because it is all about you in terms of how you see yourselves in the world. And if you're not comfortable with your smile, you don't use your smile. It's a behavior extinguisher when your teeth are worn, when your teeth are not aesthetics as you want to be, and you want to feel more confident when you face the world. And I believe that we achieve this for our patient. Smile with confidence, chew with comfort, and that's very key to good, improved quality of life for this patient. If we don't try to restore the teeth as quickly as possible, you get to the point where you cannot just simply build them using what I just did for this particular patient, because then you're involved with additional costs of doing crowns and bridges and implants, etc. So my advice would be to, just even if you got a tooth wear, to consult me. Let me have a look how far, what is the best treatment for you. In other words, most treatment should be done early, reduce wear. And naturally, if we can reduce you from initial wear by, if you tend to be bruxer, which is grinding at night or sometimes grinding at day, we make you a special night guard, which is a little clear plastic that you wear. They're very comfortable nowadays. Used to be very uncomfortable before, but now they're very comfortable because we make them with digital technology, and that really makes life very simple. And the other important thing is that as you wear teeth, what happens is they get weaker. And as they get weaker, they get sharper. As they get sharper, they get thinner. As they get thinner, they're more prone to fracture. So patients who have this, they tend to fracture their teeth. As you fracture your teeth, then you end up having crowns. And if you can't save the tooth, you end up doing implants, etc. So it does get more expensive. And this is it's critical. My time is critical, and your time is critical. I want to get the best possible outcome, as we did for this lovely patient. When you look at the results for this patient, it's quite obvious that dentistry changes lives. We do change lives. And we do change lives perhaps one smile at a time. But most importantly, you are happy.
I want to say thank you very much. I love it. I'm very succeed and beautiful.
Thank you.
I'm very happy.